Okay, everybody, today we are going to talk about a very common problem called urinary tract infections or UTIs. This is a call that we get probably once a day in our practice. And a lot of patients wonder why I am very, very particular about you leaving a urine sample for us prior to starting medications. So I frequently get asked, oh, can you just call in something for me? I have a UTI. I really want you to drop off the urine. That can be done at our office or at a Quest or a CPL somewhere by your house. They're usually open on the weekends too. And that just needs to be done before you put that first dose of the medicine in your mouth. And the reason is because we do a culture. So one, we want to make sure that you actually have a urinary tract infection. If you don't and you're having symptoms, there's a whole other option of things that could be causing this, and we need to look into those more closely. The second reason is if you do have bacteria in your urine, it is going to culture it out. So what that means is they put it in a little petri dish and they grow it on a shelf for 48 to 72 hours. And they will tell us what bacteria that is, E. coli being one of the most common ones, and then which bacteria are going to work to get rid of or eradicate that infection. So this is extremely important because if I don't have that and you start the antibiotic, I may not pick the right antibiotic. There's usually 10 or 15 on that culture that come back. And sometimes, especially patients who get frequent urinary tract infections, they will have resistance to certain antibiotics. So I need to have that culture so that I can appropriately treat you so you do not end up in the hospital with a worsening urinary tract infection that has gone into your kidneys. So this is why I'm so particular about urinary tract infections, and your provider should be too. Hope that's helpful.